Now let me speak about various interceptive procedures. We know that as a process which has a start, progression and an end. These are the procedures which we install when the process of malocclusions has already started. Okay, or we are seeing a patient once the malocclusion has started to express itself. So for an example, oral habits. Okay, now as I've explained that you have a helpful habit and a harmful habit, where that helpful habit converts into harmful when it is beyond certain period of age. Okay, so prevention or stopping of that particular habit becomes very important to prevent or to intercept, which is where the damage has already happened. Okay, whereas where we can see at that particular, these interceptive procedures can be instituted anywhere between around 8 till about 10 and a half years of age. So the most common procedures involve extraction of your supernumerary teeth, which supernumerary teeth in fact is something like which there's an additional teeth which is there, which won't have a proper shape. Basically the most common being a mesodens, which generally causes a midline diastema by its presence. Okay, when you spot that very early, so we need not to do anything, just extract that and leave the patient to grow. So automatically when the canines erupt, they just close down the natural spaces. Okay, then again, or else maintaining the spaces for the permanent teeth, or if you have lost this particular space in a particular region, you can regain that space using different removable or sometimes even a fixed appliances, or else the most commonly instituted interceptive procedure is something called as serial extraction. So for an example, you just take a room where it can house about 10 people, and you have about 12 people where you can't put them comfortably there. So obviously it's wise thing to take the 2 people out and put them to some other room. But in this case we can't put them teeth out. Basically when you don't have enough spaces for all the teeth to be there. Okay, so that's where the need for extractions come in. Okay, so when it's still developing and we have a clear indications or clearly marked indications for serial extraction procedures, we can't do it in all the cases, but there are a clear-cut indication where we can go ahead and we know that this case will develop into a full-fledged complex malocclusions. So it makes even the patient's life much more easier when the complexity of malocclusion is reduced. Say this serial extractions involves extracting certain deciduous teeth or the milk tooth at certain point of time, followed by extraction of few permanent teeth. Okay, I mean this is all a phased out treatment completely, which is done in phases. Say something like, say first generally deciduous canine and deciduous first premolars are extracted, then followed by extraction of your permanent first premolars, which erupt generally around 6 months to 8 months once you finish the extraction of the deciduous teeth. So when you reduce the number, which in a sense you are reducing the teeth material, so the teeth which will erupt later than that basically will have enough space to erupt in a much better positions, otherwise which wouldn't have happened. So this is the importance of serial extractions. So probably they might still require orthodontic treatment with the braces, but that treatment time is very much reduced, and even the complexity of malocclusion is not expressed completely because you are creating the space for the proper eruption of the rest of the other teeth. Okay, that's how it reduces the cumbersomeness of the malocclusion, the patient, and even doctor. The treatment time might not go on for a full-fledged, it might take about 1.5 to 2 years of time, or the treatment time can be reduced within a year or probably few months more than a year. Okay. Fine.
I thought you stopped at the head.
Okay, then what else? Yeah.
Continue.
Space gaining myofunctional appearances is there.
Okay.
Fine.